Hi, my name is Dawn, and this presentation is being submitted on November 8th, 2016. This is my presentation for anxiety disorder. There are tens of millions of Americans that suffer from long-term anxiety disorder. The most common form of mental health among children or adolescents is anxiety disorder. According to Dr. Daniel Pine, a neuroscientist and psychiatrist, everybody has anxiety. The tricky part is how to tell the difference between normal and abnormal anxiety. Not knowing how to handle stress can cause health issues like anxiety and depression. Thus, it becomes more difficult to realize the extent to which certain behaviors are considered normal, are linked to developmental processes, or should be treated as signs or symptoms that are in the process of structuring. The most common form of mental health among children and adolescents is anxiety disorder. Anxiety is an uneasy feeling that a person has. This feeling is normal and sometimes helpful. Many things can trigger anxiety, such as a new job or maybe taking a test. People with anxiety disorders have worries and fears that cause so much distress and may interfere with their daily life. If anxiety starts getting in the way of your health and peace of mind, then you may have a disorder. There are several kinds of anxiety disorders. Phobias, which is an irrational fear that may have little or no real danger, like spiders or heights. Social anxiety disorder. Social situations can lead to self-consciousness and anxiety. Post-traumatic stress disorder is caused by trauma and can lead to nightmares or insomnia. Generalized anxiety disorder is extreme worrying about everyday problems. Panic disorder, these are sudden attacks of terror followed by physical symptoms. Obsessive compulsive disorders are continuous repetitive rituals and upsetting thoughts. The central nervous system, CNS, protects the physical body. When people experience something emotionally or physically threatening, the body will respond biologically. A person's thoughts flow through the mind. All emotions and actions flow through the CNS. When the CNS is triggered, it starts physical reactions and communicates feelings, thoughts, and movements throughout the rest of the body by a network of neurons, cells, and organs. The CNS regulates a person's adrenaline, cortisol, and serotonin that control daily living functions. An overload of stress will activate the central nervous system's adaptive responses. Overload of physical or emotional stress can challenge the balance or homeostasis of the body. The immune system works hard to eliminate or destroy stress and anxiety reactions. During times of tension, the adrenal glands produce cortisol as an attempt to reduce the pressure. Anxiety is a silent killer that causes serious health complications related to heart disease, obesity, and high blood pressure. Anxiety, which is known as a fight or flight, is triggered by the sympathetic nervous system. The parasympathetic nervous system will help relax the body after the situation is no longer stressful. If the anxiety remains at a constant level and does not relax, the person is more vulnerable at becoming ill. Pathogens that may cause physical illnesses will get a reaction from the immune system, such as inflammation. Inflammation of the central nervous system is the leading source of chronic degenerative diseases. Chronic anxiety is a mental health disorder. It does not only have a negative impact on your quality of life, but also your physical health. If there is a threat of anxiety, your brain will flood your system with chemicals and hormones to help fight off that threat. The side effects of that flooding can result in headaches and muscle tension. The risk of clinical depression and substance abuse can be from an anxiety disorder. Prolonged anxieties can interfere with your ability to fight off illnesses, or short-term anxiety can help your immune system. There are types of anxiety disorders that may determine the types of symptoms a person may have. The general symptom may include trouble concentrating and sleeping, restlessness, nervousness, and irritability. If you're having a moment of extreme anxiety, these symptoms may appear: shortness of breath, feeling overheated or cold, rapid heartbeat or palpitations, chest pain, rapid breathing, sense of doom or danger, weakness, or trembling. People with anxiety may need counseling or medication to get their anxiety under control. If a person decides to make a lifestyle change, that may help them with their anxiety also. There are things a person can do to help with their anxiety. Avoid alcohol or drugs, get plenty of exercise, cut back or quit caffeine drinks, use relaxation techniques, get enough sleep. There is no way of knowing how someone will develop an anxiety disorder, but there are steps you can take to help reduce the impact of the symptoms. Stay active, avoid alcohol or drug use. Seek help in the early stage of anxiety. People can have different complications if they do not get help or change their lifestyles. Untreated anxiety can lead to depression, insomnia, social isolation, suicide, substance abuse, chronic pains or headaches, digestive or bowel problems, and trouble in functioning at work or school. If a person chooses to live a life with stress, they will need to change their habits and routines. People with anxiety can be treated by a family doctor who can help find the underlying physical illness. A mental health specialist is also a good resource for people with an anxiety disorder. With the proper treatment, people with anxiety can live a normal, fulfilling life.